In the ever-evolving field of medicine, advancements are constantly being made to improve patient outcomes. One such breakthrough is Anakinra, a potent treatment that has gained attention for its effectiveness in managing a range of inflammatory conditions. But what exactly is the science behind Anakinra? How does it work to alleviate symptoms and provide relief? This video delves into the mechanism of action behind Anakinra, shedding light on its transformative capabilities. By inhibiting the actions of a specific protein called interleukin-1, IL-1, Anakinra effectively reduces inflammation, relieves pain, and improves overall quality of life for patients. By exploring the intricate details of Anakinra's mode of action, we aim to provide healthcare professionals and patients with a comprehensive understanding of this remarkable treatment. Join us as we unravel the science behind Anakinra, examining its promising results, and gaining insight into its potential benefits for those suffering from a wide range of inflammatory conditions. Stay tuned to discover how Anakinra is revolutionizing the way we approach treatment options and improving outcomes for patients worldwide. Overview of the immune system and inflammation. To understand the science behind Anakinra, it is essential to have a basic understanding of the immune system and inflammation. The immune system is a complex network of cells, tissues, and organs that work together to protect the body from harmful pathogens and foreign substances. When the immune system detects an infection or injury, it triggers an inflammatory response as a defense mechanism. Inflammation is a normal and necessary process in the body. However, when it becomes chronic or excessive, it can lead to various diseases and conditions. Inflammatory conditions such as rheumatoid arthritis, gout, and autoinflammatory syndromes can cause significant pain, disability, and reduced quality of life. Understanding the mechanism of action of Anakinra. Anakinra works by specifically targeting and inhibiting the actions of interleukin-1, IL-1, a protein that plays a crucial role in the inflammatory response. IL-1 is produced by immune cells and acts as a signaling molecule, triggering the release of other inflammatory mediators and promoting the recruitment of immune cells to the site of inflammation. By blocking the actions of IL-1, Anakinra interrupts the inflammatory cascade, leading to a reduction in inflammation and associated symptoms. This targeted approach allows for more effective management of inflammatory conditions, providing relief and improving patient outcomes. The role of interleukin-1, IL-1, in inflammation. IL-1 is a key player in the inflammatory response, acting as both a pro-inflammatory and a regulatory cytokine. It is involved in various physiological processes, including the activation of immune cells, the promotion of tissue repair, and the regulation of body temperature. However, excessive or dysregulated production of IL-1 can contribute to chronic inflammation and the development of inflammatory diseases. IL-1 exerts its effects by binding to specific receptors on target cells, triggering a series of intracellular signaling pathways. These pathways ultimately lead to the production and release of other inflammatory mediators, such as tumor necrosis factor alpha, TNF-alpha, and interleukin-6, IL-6. These molecules further perpetuate the inflammatory response, contributing to tissue damage and disease progression. How Anakinra blocks the IL-1 pathway. Anakinra is a recombinant form of the naturally occurring interleukin-1 receptor antagonist, IL-1Ra. IL-1Ra is a naturally produced protein that competes with IL-1 for binding to its receptors, effectively blocking IL-1 signaling and reducing inflammation. Anakinra mimics the action of IL-1Ra by binding to the same receptors as IL-1 but with higher affinity. This prevents IL-1 from binding to its receptors and activating the inflammatory response. By outcompeting IL-1, Anakinra effectively dampens the inflammatory cascade, leading to a decrease in inflammation and associated symptoms. Clinical studies and evidence supporting the effectiveness of Anakinra. The efficacy of Anakinra has been extensively studied in various inflammatory conditions, including rheumatoid arthritis, cryopyrin-associated periodic syndromes, CAPS, and gout. Clinical trials have consistently demonstrated significant improvements in disease activity, pain, and quality of life with the use of Anakinra. In rheumatoid arthritis, Anakinra has been shown to reduce joint inflammation, improve physical function, and slow disease progression. Similarly, in CAPS, Anakinra effectively controls disease flares, reduces systemic inflammation, and prevents long-term complications. In gout, Anakinra has been found to be a valuable treatment option for patients who are intolerant or unresponsive to traditional therapies. Anakinra dosage and administration guidelines. The dosage and administration of Anakinra may vary depending on the specific inflammatory condition being treated. Typically, Anakinra is administered as a daily subcutaneous injection. The dosage is determined based on factors such as body weight, disease severity, and individual patient response. It is essential for healthcare professionals to closely monitor patients receiving Anakinra therapy, adjusting the dosage as needed and assessing for any potential side effects or complications. Regular follow-up visits and laboratory tests are often recommended to ensure optimal treatment outcomes. Potential side effects and precautions of Anakinra treatment. Like any medication, Anakinra is associated with potential side effects and precautions. The most common side effects include injection site reactions, such as redness, swelling, or pain at the injection site. Other possible side effects include headaches, flu-like symptoms, and increased risk of infections. It is important for healthcare professionals to consider the individual patient's medical history and risk factors before initiating Anakinra treatment. Precautions should be taken in patients with a history of infections, immunosuppression, or hypersensitivity reactions. Close monitoring for signs of infection and regular follow-up visits are crucial to ensure patient safety and treatment efficacy. Comparisons with other anti-inflammatory medications. Anakinra belongs to a class of medications known as interleukin-1 inhibitors. It offers a targeted approach to inflammation management, specifically blocking the actions of IL-1. This distinguishes it from other anti-inflammatory medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and corticosteroids, which have broader mechanisms of action. Compared to NSAIDs, Anakinra has been shown to be more effective in reducing disease activity and improving symptoms in certain inflammatory conditions, particularly rheumatoid arthritis. Additionally, unlike corticosteroids, Anakinra does not have the same long-term side effects and can be used as a maintenance therapy for chronic inflammatory diseases. Conclusion: the future of Anakinra in treating inflammatory diseases. Anakinra represents a significant advancement in the treatment of inflammatory diseases. By specifically targeting and inhibiting interleukin-1, Anakinra effectively reduces inflammation, relieves pain, and improves overall quality of life for patients. Clinical studies have demonstrated its safety and efficacy in various inflammatory conditions, making it a valuable treatment option for patients who have not responded to traditional therapies. As research continues to unravel the intricacies of the immune system and inflammation, the potential applications of Anakinra may expand further. With ongoing advancements in biotechnology and personalized medicine, the future holds promise for improving treatment outcomes and revolutionizing the way we approach inflammatory diseases. In conclusion, Anakinra's mechanism of action provides a deeper understanding of how it effectively manages inflammation and provides relief for patients. By inhibiting the actions of interleukin-1, Anakinra offers a targeted approach to treating inflammatory conditions, improving patient outcomes and quality of life. As healthcare professionals and patients continue to explore the potential benefits of Anakinra, this remarkable treatment has the potential to transform the lives of those suffering from a wide range of inflammatory conditions. Thanks for watching.